Good morning, good afternoon, and good evening, everyone. So my name is Phumeza Tisile. I am an advocacy officer at TB Proof, and I was also a research assistant in this particular project called Use My Voice to End TB, whereby we're empowering community health workers to destigmatize TB care. So we would like to acknowledge a few people, especially since this project was funded by the Stop TB Partnership. So we'd like to thank Tandy Katrolo and Kiva Smith from the Stop TB Partnership for their technical support. So the aim of this project is that this project was aimed to address TB stigma through a gender-responsive stigma reduction intervention and advocacy campaign based on the identified rather than the perceived needs of the community. So this project empowered community healthcare workers to contribute to patient-centered, gender-responsive, stigma-free TB care in collaboration with our community leaders and local departments of health. So we did scoping review of TB stigma interviews. Intervention, also a TB stigma training workshop with the CHWs. We were also in community whereby we did surveys and in-depth interviews with people who were affected by TB as the caregivers of people, adolescents and children who are actually also affected by TB. So also we held a stakeholder consultation whereby we were trying to framework to develop these interventions. So we developed the research protocol that was approved by the Stellenbosch University Ethics Committee. So our Stop Partnership TB stigma assessment tools were piloted and updated based on the CHW's input in a clinic in Kaili Chokot Libuyo. Surveys were also translated into Xhosa and Sotho. And as I said, participants were identified by we included people who have experienced at least one TB episode and also caregivers of at least one child who experienced at least one TB episode. So as I said, we did interviews with the CHW. So we found that CHW's roles expanded over the years and exposed them to different social issues in our communities and challenges experienced by people in the community. So they're affecting how patients deal with TB. So if patients who have TB are perceived and treated differently than other patients in the communities, this was said by CHWs, and also usage of stigmatizing metaphors describing, for instance, the physical appearance of someone due to their weight loss or excessive cough or other symptoms. So you'll find, they say this, that strong, which means looking like a drinking straw based on the size and shape of the body, which is a matchstick. So so this means that losing weight is if they were calling you, which is you're referring to someone who is being called by the dead. So from the CHW's interview, they describing TB types in certain ways. For instance, drug-resistant TB being the big TB and most associated with HIV, and also patients anticipate stigma at early stages of care when clinically ill and due to TB section isolation. And also CHWs observed patients being stigmatized at facilities and have experienced, enacted stigma. So, there were things like the CHW mentioned that someone will say that the doctor does not want to touch my child during an examination. He would ask me to cover the child. So another thing was that the nurses would chase me away and say, we told you to stay there where you belong, referring to the isolation room to the one who is actually affected by DMD, someone who is a patient team patient. So CHWs recommended that TB awareness and education programs are needed, stigma reduction initiatives such as not singling out patients out through colors of their clinic card. So this is a problem and still is, because you will find in most clinics that TB patients carry a different color card compared to other people. Other people's cards are white, whereby the TB card is different than the others. and also counseling and psychosocial support to patients during and also post-TB. It's very, very important. Food and nutritional support to patients, especially, I mean, we know TB medication, you cannot take medication on an empty stomach. So you need to have food that is nutritional to help you to get to cure. And also they recommended that they need to transport and support the different situation they come across. I mean, they were telling us that even when it rains, like even when it pours, they have to walk by foot to the patient to deliver the medication. They don't get much needed support, such as transportation to take them from the clinic to the patient house and back. So this is a challenge they face, but because they are very passionate about the job they do it without even complaining about it. So with the TB stigma surveys, so at the time we did 48 TB survivors and 24 caregivers. As I said at the time, now that had changed, we need to update. And also we found out at the time that 81% of TB survivors choose carefully who they told about their TB status, whereby 50% feared telling their families about having TB. So when it comes to anticipated stigma, over 40% of participants agreed or strongly agreed with the following statement, meaning that they have worried that people might talk badly about them, that they had TB. They have worried that they will be undermined by people if they find out they had TB. They have worried that people might hurt their feelings if they find out that they had TB. And they were also worried that they will lose respect in the community if they find out that people had TB. And lastly, they were worried that if someone found out that they had TB, they would think that it was because of the smoke or the drink or do other things that might think of as careless about their health. On enacted stigma, so here we find that 42% of participants agreed or strongly agreed that people have talked badly, gossip about them when they find out they had TB, whereby 39% of participants agreed or strongly agreed that they felt alone because they were living with TB. And also 32% of participants agreed or strongly agreed that people have seen them at the clinic and therefore learn that learn their status without wanting to disclose to them. So when it came to internal stigma, over 30% of participants agreed or strongly agreed that they probably got TB because they drink or they smoke or they do careless things. Others felt that they should keep a distance from people to avoid getting TB germs. And others, they say that they have less respect for themselves because they had TB. So support they received during TB care was that 56% of participants agreed or strongly agreed that they have been able to access financial material support such as SASA or NGO program. So SASA is like a South African support thing whereby you will receive money in case you get sick, especially with TB. So it assists you because when you have TB, in most cases, you are not allowed to go to work. So that's where SASA comes in, sort of like a support whereby it assists people to be able to buy themselves food. And also 50% of participants have agreed or strongly agreed that they were able to access psychosocial support through things like adherence clubs. And also 49% of participants agreed or strongly agreed that their families and friends have reached out to give them extra support once they learn that they have TB. So we wanted to know where is the stigma sort of like happening, where is the stigma occurring? So when it comes to anticipated stigma, we find that 18% of people said it was happening in hospital or clinics where they received care, and also 15% in the community where they live, and 10% in their own homes, whereby when it comes to enacted stigma, they say that 30% say that healthcare workers at hospital or clinic where they receive their care, people in their communities where they live, that was 11%, and 10% said that patients and other people at the hospital or clinic where you receive your TB care, members of their own home, and also people at their workplaces. So as you can see from this side, the impact of TB stigma on accessing care, as you can see on the slide, anticipated, enacted, and internal stigma impacted each of the TB care cascade steps, whereby internal stigma caused a delay in recognizing TB symptoms, going to the clinic, starting on TB treatment, and completing actually their treatment. So this heavily impacted access to TB care. So after the surveys, we did the TB stigma interviews, which is in-depth interviews, and we were able to get TB survivors who were females and males, and also caregivers who were females and males. So TB patients are looked down by their communities. That is the findings that we found, whereby we sort of like getting a general perception of TB stigma. People be sort of like in your business, in your face to ridicule you, or they might be concerned. You never know. People being judgmental and demanding to know what is wrong with the TB patients. Assumptions that the person is sick with TB is also, living with HIV. This is a sort of like an ongoing thing, ongoing stigma that is occurring in every clinic, because people assume that if you are sick with TB, you are HIV positive. Not that is anyone's business, but why should people sort of like stigmatize what they barely even know? And also, it helps sort of with the COVID-19, whereby everyone now was required to wear the mask. I mean, before COVID-19, only TB patients were required to wear the mask, and it was another sort of like a problem. Even TB Proof had sort of like a campaign called Unmask Stigma, so that we needed to normalize that the patient wearing the TB mask, they are protecting from spreading the germs to the other people. So this was the problem, and now with the COVID-19, it's sort of like help, because now everyone wears the mask, but still stigma is still there. Stigma is still there. So people sort of like, they don't share that they are sick, so they kept their illness to themselves to avoid being stigmatized by people. So we also found that communities are grateful for person-centered care and support, which is provided by our community healthcare workers. So we anticipated stigma as experience based on appearance, for instance, the skin color changes, and also the association with HIV. I mean, if you were sort of like myself, for instance, I'm dark skinned, but I was darker when I got TB. And also the weight loss is there because you are sick, you're not eating as much as you want. And also there are other things that are going around. So you are not as healthy looking as people want you to be. So they sort of like, anticipate stigma that people might say something bad about you without you even saying anything. So caregivers that we interviews are also worried that the community might say hateful things about their children if they find out they have TB. And also teachers were supporting the child throughout the TB journey. Very important. As you know, kids like to tease each other. It was really helpful to hear that the teachers were supporting the child through their TB journey. Participants will sometimes hide it from their family members and fear being gossiped about by their friends. So this was also an issue where people didn't even trust their families because they had TB. Again, it was also anticipated. So enacted stigma, it's where friends stop visiting at a friend's house who's actually sick. So the lesson we've learned is that communities identified a need for TB counseling for one. Social workers should support patients. And also people affected by TB were often emotional during interviews. It was the first opportunity for them to talk about what they've gone through. And also the economic impact of TB is putting families under a lot of pressure, especially with social grants being sometimes delayed. And also there's long queues and people can't stand it because you are already sick now. You are sort of like having to stand in a line for hours waiting to be helped. And then when you get in front of the line, you say that the system is offline, then you have to come back again tomorrow. I mean, you're already sick now, you have to get the support that is actually out there. It's actually a challenge for you. as a person who has TB, who needs this support, this social grant support. So this was another thing. And also challenges, as I said, challenges on getting SASSA grant, which is there's overcrowding, and especially now in the times of COVID-19, there's another social relief grant that was introduced by the South African government, and the lines now are crazy. Like people wake up around 5 a.m. just to stand on the line there, and then they don't even get the help they need because the system crashes, and there's different lines for everything. So people are in need of help. And then at the time of these interviews, people were not getting the support they need when they need it. They had to wait longer than usual. So project challenges. So at the time of the data collection, we were on the peak of COVID-19. So high quality N95 respirators for research assistants were sort of like needed, especially since we're working, I would say, high risk, which is TB and also COVID-19. So for the Hammanskraal, for instance, we were granted to do the telephonic interviews for data collection using the surveys, which is Hammanskraal is in Gauteng province here in South Africa. So we were all vaccinated before we were actually able to go to the communities and do these interviews. So we did take this to the Twitter chat, which it had almost 6 million impressions. And we actually have another Twitter chat tomorrow at 7 p.m. South African Standard Time. And of course, the hashtag is TB Proof. This is very informative, and you find different kinds of people. Obviously, there will be a different panel on this particular Twitter chat that will be happening tomorrow. But please do join it and interact. You don't have to be on the panel to be part of the Twitter chat. Just use the hashtag TB and you'll see your tweet, and you will retweet, and we will get the word out going. So key messages is that we need stakeholders to refer people near their household, which is for social support, and also research assistants need counseling too, as some issues were heavy and we thought about them more often. Research assistant, we're also needing training on how to deal with disturbing matters. So all in all, awareness is needed. So just to clarify, we're in the part of research assistant needing counseling. So we've heard like very sad stories whereby we're interviewing our participant, and sometimes you can't help but put yourself in their shoes, like how did they deal with that? I mean, one particular one was very, very disturbing that we had to talk about it over and over so that we can get over it. So of course, this is not easy, as we are also the people who are actually on the ground, which is myself and Goodman Wakanda, TB survivors. So we know what it means to have TB, and now having to hear different stories of people who actually had TB recently. It's very, very sad because we've been fighting for stuff, for things to be better when it comes to medication, when it comes to stigma. And then now we are hearing these stories through interviews from people that they are still going through a lot when it comes to them having TB, and also when it comes to them, to receive their social grants so that they can be able to take their medication on a full stomach. So yes, that was it. And again, we'd like to thank our Stockholm Partnership, the University of Stellenbosch. And that's it. Thank you for listening. And again, as I said, my name is Phumeza Tisile. I am from TB Group. Thank you.